So you want to identify these structures on MRI. So you have an axial cut. This axial cut passing through the thalamus. So it passes which horns? Anterior and posterior to the thalamus. Which horns?
Anterior, the frontal horn.
Yes, and posterior?
The atrium and the posterior horn.
Exactly, atrium and occipital horn. So here is the thalamus, and the frontal horn is here, and the atrium is here. If you make a cut that's above the thalamus, so which horn will be shown?
The trunk.
The body. The body, yes. So this is the body, the lateral ventricle. And you start to see the beginning of the frontal horn, angled with lateral angle, and the beginning of the atrium also, lateral angle like this. But this part, the central part, this is the body. Okay. When you have a cut that's below the thalamus, so what is the first part of the brain stem below the thalamus?
The midbrain.
Midbrain. So you see here, this is the midbrain. And you see here's the temporal horn like this. Okay. So now if I give you an coronal cut, can you identify these horns also? So if you have a coronal cut passing through the thalamus, which horns will be included?
The body and the temporal horn.
Very good. So you see here in red, this is the thalamus. Above it, this is the body. And here is very, very small temporal horn right here. If you pass anterior to the thalamus, which horn will be shown?
The frontal horn.
This is the frontal horn. If you pass behind the thalamus, which horn will be shown?
The atrium.
The atrium.
Or triangle. Very good. So how can you identify? Meaning you are going to see an MRI like this one. How can you identify which part of the ventricle you are in? So first thing, which part, which ventricle, which is this part lateral? Is this horn lateral or paramedian? Midline is here. So is it lateral or paramedian?
Paramedian.
Paramedian. And here, the body?
Median.
Paramedian. This one, right here?
Paramedian.
No, it's lateral. Meaning here, here it touches the midline. Both horns touch the midline. Here also, both horns touch in the midline. But this one, they are far from the midline. So watch like this. Watch here. Remember this one? We said that frontal horn and body, your index fingers are touching. They are in the midline or paramedian. But your atrium is far from the midline, and temporal horn is also far from the midline. Okay? So, we come back here. So, if you have a ventricular system that is away from the midline, like this one, it's lateral. So, this is do you want me to repeat it? Okay, so please, you are going to repeat this one. So bring your hands, C-form, like this one, and put your hands like this. Touch index fingers and touch thumb. Please, everyone do it. And now you start to push thumbs away from each other, but you keep your index fingers attached. So the atrium, is it? So the frontal horn and body, they are here. They touch in the midline. They are paramedian. This is the midline is here. They are paramedian. The atrium, is it paramedian?
No, it's lateral.
Lateral. And the temporal horn?
Lateral.
Lateral. See, midline is here. We are far from the midline. So let's go back. So this part, is it?
Lateral.
Lateral. So which part is it?
The atrium.
Is the atrium, the trigone.
Atrium or trigone. If you cut here, you will give also the occipital horn. It's much smaller.
Yeah, the posterior horn.
Yes. So Now you need to identify if you have a ventricle that's paramedian. Both of these are paramedian. What is the difference? How can I identify it? So you see here, this is a body. It's quadrangular in shape. There is a medial wall, inferior wall, lateral wall, superior wall. It's quadrangular in shape. But the frontal horn, it's triangular in shape. There is a superior wall, lateral wall, and medial wall. So how can you identify a ventricle on coronal cut?
The frontal horn is triangular.
Triangular,
The body
paramedian.
is quadrangular.
Triangular paramedian. The body is
Yes, sir.
triangular paramedian.
The body is quadrangular and paramedian.
Yes, and the atrium.
While the atrium is lateral and looks triangular.
Yes, we not speak about the shape, but it's lateral. Yes, it's like eardrop or something like that.
Teardrop.
Teardrop, yes, sir. Okay. So is this part clear for you?
Yes.
Okay. Because you are going to use this information to localize everything afterwards. So you need it needs to be clear.